From the Zoomerplex in historic Liberty Village, theZoomer, hosted by Libby Znaimer.
Welcome to theZoomer. I'm Libby Znaimer. Hearing loss is the third most common and the fastest growing chronic health problem among Canadians today. Nearly 70% of adults over the age of 50 have not had their hearing tested in the past 2 years. So why is hearing health so low on our wellness list? And why do we wait an average of 10 years, a decade, before dealing with hearing loss? We sent Zed News videographer Darren Maharaj to get his hearing tested.
Did you know that 37% of Canadian adults suffer from hearing loss? And even more people over 40 suffer from a high-frequency loss and don't even know it. That's why experts say once you turn 30, you need to get checked regularly. So I'm going to take this opportunity to finally indulge my wife and get my hearing checked.
We tend to kind of overshoot our listening to different things, music and things like podcasts. We're using headphones quite a bit, and we tend to turn things louder to compensate for the environmental noise. Can I get you to repeat the words for me, please? Say playground.
Playground.
Daybreak.
Daybreak.
What we're trying to achieve is the threshold, or the quietest level that they can hear. Say perch.
Perch.
Say fit.
Fit.
So she's hearing a series of tones or beeps at different frequency levels. There's a little bit, a mild degree of hearing loss. It wouldn't jump out to me to say, you know, you're a candidate for hearing aids at this time, right, but I can appreciate how that tinnitus or that ringing in the ears would be there.
Okay.
Hearing aids come in a number of different styles. In the ear style hearing aids that customly form to the ear, and then an over-the-ear style hearing aid, which is a very popular model these days. They're Bluetooth compatible, and a lot of younger adults actually use them for headphones as well.
Hi, Doc. Padlock.
Sunset.
Sunset.
Anytime you hear the beep, even a very, very soft, distant one, push the button. Hey, Darren, all done. So overall, Darren, nothing too concerning. Your word testing was also very good. Normally, speech occurs in and around this range. So that's why your scores are excellent.
Have a little dip over here.
You do have a bit of a dip. So in your case, you do have a bit of high frequency hearing loss.
So the statistic, I fit the statistic. A lot of people over 40 don't realize they even have high frequency hearing loss.
Correct.
Now, the second most important thing is, can I use this as an excuse to my wife when she says I'm not listening? Does that work?
No.
Nice try, Darren.
One thing I would say to help preserve your hearing is try to limit the level at which you're listening to, as well as wearing ear protection in noisier environments.
For more great tips on how to prevent hearing loss, visit carp.ca. Here in Oakville, I'm Darren Maharaj for Zoomer News.
Playground.
The wife joke is funny, but I've got to say that's a common way that some people, especially male people, laugh off and trivialize their hearing issues. What have you found?
Yeah, I think that that's definitely a contributing factor to bring people in is their families that are noticing the hearing loss and are noticing that the TV is louder and is the ones that are saying you got to get your hearing checked.
I can tell you at home, they'll say, okay, I'm going to get my hearing checked, but between saying that and doing it, there's a big gap. Dr. Witterick.
Well, it's so easy to get your hearing checked these days. There's free clinics. You can go in anytime, they're open. And there's also hospital-based clinics that are very useful, and it's quite a simple thing to do. And we encourage everybody to do it, find out where their baseline levels are.
Yeah, I think you're right. There are some common objections when we do present with results of that there is some hearing loss. Denial is a big one, but in that individual's defense, hearing loss is typically progressive. And so the changes happen very slowly over time. Often it's the person who is struggling, they're the last to know. So sometimes there's denial happening. Other times people just really don't know that they have hearing loss. It's happening over a number of years. And that's why loved ones, spouses, usually notice it first and are the person to tell you, I think you're not hearing very well. I think you should get your hearing checked. And it's because you don't know what you don't hear. So always getting a baseline test is the first step, because we need to know. So come and get it checked, and you'll have that information, and then you can move on from there.
So why is it that people wait an average, it's shocking, a decade, 10 years?
I don't think that is as common that people realize. Like Jillian was saying, that unfortunately it's a progressive thing, and so they don't realize that they're not hearing. And so when they notice it, it's usually when they can't hear somebody in noisy background. So at meetings or at restaurants, they start to have trouble, and that's when it impacts them and they can't hear. Then that's when they start to sort of say, oh, maybe I should get it checked out.
I'd say the other elephant in the room is the stigma with hearing aids. So people may notice that they have hearing loss, but they don't want to wear the hearing aids. The good thing is that with the technology, things are getting smaller and smaller and more discreet. So there really is a hearing aid solution for everyone out there. We just don't necessarily know that. And so we're constantly trying to break that stigma that get your hearing checked. If you have hearing loss, we can do something about it. And it doesn't have to be that old, giant hearing aid that everyone associates with hearing loss.
No, exactly. That I liken my grandfather had these enormous hearing aids, and he would not use them. And then he went around telling everybody that hearing aids were useless. And so a lot of people have that sort of notion that they're no good. But the new technology is actually quite remarkable. And the audiologist can tune it to the frequencies that are lost. And there's Bluetooth technology. They can turn it on and off. And a lot of them will even work in noisy environments, which has been the hardest thing to actually match.
I think, and when we're talking about elephant in the room, the other issue is that hearing loss is associated with aging.
Yeah.
And so it's individuals who don't want to admit that they're getting older and maybe they're not hearing as well as they once did. So I think the denial comes and the stigma comes from that it is very much tied to aging. And so we have a very large resistance towards treating your hearing loss because wearing hearing aids is a sign of getting older. However, hearing loss is happening in all ages and younger. And so it really isn't a sign of aging. It's one of our 5 senses, and it's so important. So we need to sort of get over that stigma associated with hearing losses as a sign of aging and that being a negative thing.
What about things like vertigo?
The nerve that supplies the hearing and balance organ is the same nerve that splits into the two. So a lot of times when you have hearing loss, sometimes you can be associated with vertigo. So depending on the disease process, those two things are related. And I think that hearing is important because what happens is when you're walking around, there are sort of cues around your environment that maybe you can hear and you pick up, but when you stop hearing those things, then you can start losing your balance, part of it, because of that reason.
As Dr. Chen said, there are some specific diseases that are related. There's a hearing loss component and a balance component. And so that's also why it's important to come see an audiologist who specializes in balance problems so that we can test to see if we can diagnose where the problem lies.
Okay, we're going to take a short break. We'll be right back with more of the Zoomer. Welcome back. Tinnitus, the annoying ringing in your ears, is more common than you think. 43% of Canadians aged 16 to 79 experience tinnitus in their lifetime. More men than women are affected, likely because of the greater exposure in general to loud noise at work, school, and leisure. But what exactly is tinnitus? And it's not necessarily ringing. There are a range of symptoms. Joining us at the table is Christine Acree. She's been suffering with tinnitus for over 10 years. Welcome to the roundtable, Christine. Tell us a bit about your experience.
Thank you, Libby. I've been suffering with tinnitus. Some people call it tinnitus, but it's tinnitus. And it is a ringing in your ear that never goes away. I have it right now, so I can listen to what you say and I can hear you a little bit, but there's that buzz that's constantly going on. And I didn't go to loud concerts when I was young. I don't know what brought this on. It's been happening for over 10 years, like you said. And I was in a car accident a few years ago, and that exacerbated it, made it even worse. So, and it also affects my balance because I'm not hearing the cues around me. So sometimes a car is coming and I'll miss it and I'll hear it at the last minute and I'll fall. And it's a very serious problem. And from what I've heard from all of the experts here and elsewhere, there is no cure for this. And I've tried different therapies. I've tried cognitive therapy. I've tried, background sounds. I've tried patches, gummies, weed, all kinds of different things. Everything that's been suggested to me, nothing works. And I just don't want to go through life, the rest of my life, with this hearing problem. And plus, my hearing is bad. I had it tested 10 years ago. Like you said, that 10 years is perfect. I have little or no hearing in this year. And I'm just wondering if hearing aids could possibly help me. But I'm a fixed income senior and I can't afford it right now.
Well, what I've heard about it is that, yes, hearing aids do help. And it's not always ringing. I have a little bit of it, and it's like white noise. It's like hash. Yeah. It's more common at night. It's kind of, what I have is really not a big deal. And what I'm told is that, yes, hearing aids help. What can you tell us about tinnitus?
So unfortunately, we don't know what really causes tinnitus. The two most common causes that we know are hearing loss, likely age-related, or noise-induced. So after a concert, you start to hear something in the afterwards for a sometimes short time. But unfortunately, if you have repeated exposure, you can get sort of prolonged tinnitus or chronic tinnitus. And tinnitus can sound like various different things. It can be a tone, it can be a pulse, it could be, a ringing. Some people hear music. So there's a range of different noises that you can hear. And as Libby said, unfortunately, there's no cure. But Emma has some experience with treating tinnitus.
Yeah, so as Christine mentioned, there are a few things that we can do in trying to help people really adapt to the tinnitus, take that tinnitus and tone it down. So one of the things that you mentioned was a masker. So you can put white noise on in the background kind of thing. And that the idea is that you're no longer paying attention to the tinnitus, you're actually paying attention to the masking noise. And that masking noise, we try to bring it down and lower and lower and lower and quieter over time. And the hope is that that brings the tinnitus down over time. That's one of the things that we can do. We also do a program, at least at our hospital, there's lots of different retraining programs that you can do. Cognitive behavioral therapy is another one. The biggest thing for us is hearing aids. So by putting hearing aids on people who have hearing loss, we're correcting for the hearing loss, and that's giving the brain that input that you're missing. And by doing that, it's helping the brain kind of adapt to the new environment and the sounds around you, as opposed to the tinnitus. The disadvantage of the hearing aids is that when you take them off at night, the tinnitus is still there. So we do hope that you put some noise in your room so that you're not noticing when it's quiet.
I've heard about a treatment that's kind of based on meditating.
We always will recommend anything that you can do to relax. Stress management is a big one. And along the same lines, caffeine intake and certain medications, going to your doctor and asking if there's any medications that could be causing the tinnitus. But any type of relaxation is going to be better.
That sounds wonderful. I've just signed up for a mindfulness course.
Perfect
as a
timing.
matter of fact. So, and also I feel like I've got a lot of company in this area because, like Libby said, and so many people have this, and maybe they just don't know, and they think, oh, I've got a ringing in my ears, I'll just ignore it. And even my favorite, William Shatner, has had it for years, and he can't get rid of it. I mean, with him and all his resources, he can't cure it. There's no cure, and I'm just wondering, is it a connection that's not being made, or an extra connection in your brain, or what is causing this? That's what I don't know.
Have you heard about this this new kind of a treatment that basically involves some form of meditation?
Yeah, I've certainly heard about it, and we have people go and do that, and it helps some, but not all. And so there's no one treatment that works for everyone. But hearing aids are certainly a great start, and then meditation and other kinds of cognitive behavioral therapy work. The one thing I wanted to say is that there's one warning thing that we talk about, and that is if you just have one ear that has a ringing in it, or particularly with hearing loss, and then later some balance disturbance, because there's a benign tumor that can press on the nerve of hearing inside of the brain, and that can cause one-sided ringing, hearing loss, and balance disturbance. So if that's the case, we recommend people get checked, and if we see a unilateral or one-sided problem like that, we recommend doing an MRI to make sure people do not have one of these benign tumors. And so that's an important thing for people to recognize if it's just one-sided.
When we come back, we'll be discussing the link between hearing loss and dementia. Welcome back. Hearing loss has been linked to a range of health problems, including dementia. The latest research not only shows that the two are connected, but some scientists believe that hearing loss may actually be a cause of dementia.
I think, I don't know that it specifically causes dementia, but there's definitely a link between the two. So demented patients with dementia actually has a higher rate of hearing loss and vice versa. So the question is, what's causing what? And nobody really knows, but certainly there's an association for it. And the lack of auditory input is probably causing part of your isolation, and you're not using parts of your brain because of that. And perhaps that is what is causing the dementia, or leading to dementia.
Yeah, I agree entirely, but part of the hearing mechanism is not just the ears, it's actually the pathways that go into the brain. And if there's deterioration in central function, you can lose hearing. The other big thing in our area, in the ear, nose, and throat, is actually sense of smell as well. That's an early sign of disease process and linked to dementia and some forms of dementia with that. So we're recognizing that more and more, but the social isolation, I think, is really critical. And I've seen that. Like I mentioned my grandfather before, and he would just sit in the corner at family functions because he just couldn't hear, and he couldn't interact with people, and he eventually did develop dementia.
I had this incredible experience. It was a long time ago. I went to a birthday party for 10 centenarians, and just about the oldest one, she was about 105, and she looked amazing. And she said, I've had enough, I don't want to live anymore. I sort of said, why? You seem to be in such good shape. And she said it was because I can't hear. And I thought, what? That doesn't seem like a big thing, but I can't hear, and I can't have the same kind of relationships that I used to have with people. That was really eye-opening for me.
Well, that's somebody who definitely needs to see one of these two individuals, you know. Yeah.
Well, when you think about, if you do think about hearing, that's the thing, is we often don't even think about our hearing. We take our hearing for granted. There's no on-off button for your ears. They're on all the time. But if you actually really just for a moment thought about how much information your ears actually give you, your eyes put the world in front of you, but your ears put you at the center of it. And so when you don't have hearing, you lose connection. And we are social beings, and we connect to people. So it's emotional. And this is why it doesn't surprise me that not feeling connected to the people around us is lonely. It's loneliness, it's isolation. And we just really don't think about it that often because most of us just take our hearing for granted until something goes wrong, until something isn't working as well as we hoped. And then we realize the importance and how much it impacts our daily lives.
In my own case, I had a bunch of hearing loss that seems to have been reversed, but I was on some very intense cancer treatment involving immunotherapy, which then it kind of attacked my own immune system, and suddenly my hearing was terrible. And now it seems to be back to what it was beforehand. I don't know how great it is. So are there lots of scenarios where you can recover hearing loss?
There are some scenarios, certainly, that you can recover hearing loss. So if there's some dysfunction in your hearing organ, the cochlea, sometimes that can be a fluctuating hearing loss. That's cochlear, wouldn't call it Meniere's, but cochlear Meniere's disease, that you can get a fluctuating hearing loss. You can also get swelling of the hearing nerve itself, and that can cause sudden hearing loss, so a viral attack of it. So sometimes COVID or other flu, other viruses that attack the nerve of hearing can be something that you present with a sudden loss, and then you can treat it with steroids that will decrease the inflammation of the nerve, and that can recover your hearing. So sometimes these things can be reversible, but not a lot.
Yeah, another common one is people get fluid in their ear, so behind the eardrum. So after a cold, you can't clear your eustachian tubes, or they go on an airplane. That can cause problems with that, and that can take months to resolve with that. It's a common reason that children have tubes put in their ears to try and get the fluid out and the eustachian tubes working better.
And what is there something called swimmer's ears?
That's more of an infection of the ear canal with it. So swimming in lakes and ponds, not usually swimming pools, can cause sort of a wet, bacterial infested ear canal, and then you get a draining ear that can be quite painful. It's usually due to a specific bacteria that's easily treated with drops and cleaning the ear. Sometimes fungus, though, can do it as well, so we have to do other types of treatment for that. And
that'll affect your hearing, obviously.
Yeah, because we think of hearing as conductive, meaning that the sound just can't get into where it's supposed to be, and sensory neural, meaning that the nerves are not getting the signal to the brain. And there's other degradations of that, but it's basically conductive or sensory neural. And so it's almost like you put a piece of cotton in your ear, you just can't hear as well.
Interesting. We'll be right back with more of the Zoomer.
My name's Alfred, and I had a question for the panelists. I was wondering why the cost of hearing aids are so expensive, because it seems, you could buy earbuds that are $200 that do a lot of things, and I'm not sure why you're paying up to $2,000 to $3,000 for one hearing aid.
Okay, thank you for your question, Alfred. Over to you, Jillian.
Yes, I wish I had a very easy answer for that question, because it is what most people want to know. Hearing aids it's a digital computer. When you think of a computer, it's actually more powerful than the computers that we use to do our work. The amount of input that is coming into that hearing aid and being analyzed and digitized to provide sound and output, it's highly sophisticated, highly, highly sophisticated. It is also uniquely programmed to an individual's hearing loss. So we are trying to essentially bring back the sounds that the ear is not hearing naturally anymore.
Let's have a look at,
Sure.
so this hearing aid here, and this is pretty standard, but you can get different levels of technology inside this hearing aid. So why don't you explain that?
Yeah, so this is sort of a very popular model today. It's obviously a lot smaller than, say, a hearing aid of yesteryear. You know, the clunkiness has gone away. These are heavy, clunky, and a lot of them were not even digital. They were analog, so the sound is not what we hear today. These are digital hearing aids, so everything is high fidelity, sophistication. But what is going inside of this, and I don't want to use the analogy, but it's very, people can understand it, so I'm going to compare it to a car, even though it's nothing like a car. However, when you go to purchase a car, you have a basic model, right? And it'll get you from A to B, but it may not be the most comfortable ride. As you add more features, safety packages, comfort level, there's heat in your seats, there's power. As you add more items, the cost of the car goes up, but the enjoyment of driving that car also goes up, and maybe your safety also goes up. Technology in a hearing aid is very similar. You don't have to pay top-of-the-line prices for a hearing aid. If you want the best of the best and an extremely enjoyable experience with a hearing aid, then you want to look at a premium model. However, if you just want to hear better, then a basic model is going to do the job.
Okay, the biggest criticism I hear about hearing aids is the level of the background sound, that it doesn't deal with lowering the background while increasing the person who's talking. So at what level does a hearing aid fix that?
Exactly. So background noise is the hardest thing to tackle, because background noise is usually embedded within speech as well. So you go somewhere and you're talking to someone, but you can't pull out a conversation. A hearing aid isn't smart enough to know that I only want to hear you and I don't want to hear anything else, right? But that's the way our ears usually hear everything. However, our ears do an amazing job at filtering out background noise. But once there's damage to the auditory nerve, we don't do a good job anymore of that. A hearing aid is trying to understand what it is that you want to hear and what you don't. Technology, so what that hearing aid is doing, will do a better job if you go with a premium model, because more is happening in the hearing aid. There's more analysis, there's more technology that is trying to pull apart background noise. Just for example, the latest hearing aid that's coming out very soon has sensors in it for head movement. So there are actually sensors that will be able to determine that I want to hear you because I'm looking at you and my head is directed towards you. And maybe I don't want to hear you right now because I'm not looking at you. So this is the type of technology, and why they cost so much is they're so advanced.
And what happens to the background noise, the kind of din?
Well, it's going to essentially filter that out, reduce that. We don't want to not hear background noise because that's not normal. Right? In order for us to understand what's going on in our world, we do need to hear those sounds. We just don't want it to overpower. And I also want to say a hearing aid is not a cure, it's an aid. So we cannot restore normal hearing, but we're trying to do our best with this piece of technology to give you the sounds back.
How many levels are there in terms of the cost?
Typically, we try to work within 3 levels. We try, I mean, there are just so many options out there. We don't want to make it complicated or difficult to make the choice. We're here to help guide you through the options. We work within sort of 3 levels of pricing within those technologies, and obviously it's up to you.
And the range goes from where to where?
About $3,000 to $8,000 for a set. Yeah. Now there are subsidies available depending on where you live. So there is some government assistance in some provinces in Canada. Other provinces do not have subsidies. However,
Ontario and BC?
Ontario has a subsidy. They do have a subsidy. So we do have some coverage in Ontario.
BC?
BC does not have a government funding program. No.
And what are the, do you know offhand what the other provinces that have them are?
Alberta has some assistance. And I'm not sure if I think it's Alberta and Ontario that have a very structured, dedicated government assistive program.
Christine, do you have any questions?
How do I access that?
Yeah. Well, step one is to go to a hearing healthcare professional. So you're going to go see a professional, and we know all the information about what is available in terms of funding, and we're going to make it really easy for you. So every Ontarian is eligible for this funding. You don't have to jump through hoops to get it. And so we will just help you fill out the paperwork, and it'll be applied to the cost.
Do you have to be a certain age?
You do not.
Perfect.
Okay, it's time for a quick break. We'll be right back. Welcome back. Now it's time for questions from our studio audience. But first, we have a video question from RJ.
Hi, my name is RJ. My question for the panelists is about Q-tips. Are they safe to use in your ears, or should I be looking to use alternative options like an ear cleaner with a camera on it or silicone spiral ear cleaners?
We advise that you do not clean your ears at home, especially with a Q-tip. A Q-tip is actually not designed for that, and it never was designed for earwax removal. We just happen to use it that way. It can be dangerous. You can push the wax in further. And I have personally removed many pieces of a Q-tip from people's ears, and that has caused them pain. So try not to put anything in your ears or clean them yourself at home. Please see a professional first, and then we can give you some guidance on what to do next.
So an audiologist or a doctor?
Either or.
And will your GP do it?
Your GP will definitely have a look, and if wax removal is needed and necessary, they can often do that in their office. However, audiologists can do that for you as well. You should never have to have your ears clean. Your ears are self-cleaning, and so wax will just migrate out on its own. It does everything it needs to on its own. If there is an issue like wax buildup, or you feel like you have too much wax in your ears, some people do overproduce wax, that's when you can come in and see us, and we will also give you a schedule of when you need to come and have it looked. But most of us should just leave your ears alone. They'll do all the work themselves.
Thank you, RJ. Next, we have Paul. Hi, Paul.
Good afternoon. I'm part of that 30% that have had my hearing tested over a period of years. Initially, I guess I was just too young to think I had hearing loss or needed a hearing aid. And also the cost is certainly a concern. If I continue not to get a hearing aid, is that going to exacerbate the hearing loss, or will it just progress naturally?
It'll progress naturally. Getting a hearing aid won't make it stop or change it with that. But we were talking just in the break that it's possible to get a trial period with a hearing aid. Mm-hmm. So we often encourage people, try it out. And it's very easy to return if it's not meeting expectations. So I really think people should try it and see if they like it or not.
Okay. And is this from any company will have a trial, or is this a specific or unit, brand?
No, I believe most hearing aid dealers will give you a free trial period that lasts up to about 90 days, is that
Yeah,
correct?
It's by law that we give a trial period, and it would be up to the clinic to determine if they're going to have a non-refundable deposit, but that would be clinic dependent. So, 90 days would be pretty standard, I believe.
Because I know I'm a member of CARP, and I do get ads through email and whatever for that kind of thing. So do they offer, or they have associations with other companies?
Some do. So at HearingLife, we do have a CARP association. So some clinics will offer based on if you're a member of CARP or any other affiliate. So It's always good to mention that when you do go in to say, inquire about that, because there could be additional discounts.
Okay. Thank you very much.
You're welcome.
How many people return their hearing aids? What percentage?
I don't have an exact percentage, but it's actually fairly low. And I think a lot of individuals would actually say the opposite of, I wish I had done this sooner. It's just getting to the point of accepting that it might be time to do this and to try a hearing aid. It is, once you've tried a hearing aid, most individuals are really happy with the improvement because it's an overall quality of life improvement. But hard to know that until you try.
But what if you, like you're thinking of test driving, thinking of a car. I recently bought an SUV, but I went and test drive 3 models. Can I test drive other hearing aids?
You can. You can try different levels of technology. You could start with one level and maybe try a different level if that's what you want. I think the point here is to just try something.
Yes.
I think you'll notice a huge improvement. And we also never really touched on, what is the impact of auditory stimulation and not having auditory stimulation. So in essence, you are sort of overloading the brain when you're not giving it auditory input. And we don't want to do that for too long. The adaptation period for adjusting to hearing aids increases the longer you wait. So you're not really doing yourself any favors by not trying. So
Okay.
I hope that you will consider at least trying
Yes, well-
and seeing how that goes for you.
Certainly.
Your brain will thank you.
Okay. Thank you, Paul.
Thank you very much. Thank you.
And next we have Henry. Hi, Henry.
Hi, how are you?
Great.
So I have a question. Last week I went for one of the free hearing tests at one of the clinics. And I did ask the technician, are you an audiologist? And he said no. And he mentioned some other profession. And I asked, is that a licensed profession? He said yes. Okay, I did the hearing test and he recommended, 3 different levels of hearing aid down the road. And then I went and inquired for my workplace benefits plan. My workplace benefits plan will give me certain percentage of a hearing aid if it's prescribed by an audiologist or a medical doctor. So what can you tell us about non-audiologist, non-medical doctor professionals who can?
So specifically in Ontario, there are 2 professionals that can prescribe a hearing aid, a GP, so a physician, and also an audiologist. So both of those professions are regulated health professions. And so the difference between who you saw, who is non-regulated versus an audiologist. Without getting into too much detail of the differences, the main difference is the scope of practice for an audiologist extends to pediatrics, as well as prescribing of hearing aids, where the other profession is mainly focused on adults and dispensing and fitting of hearing aids. So everything that happened, they are able to do, but just the scope of practice is broadened for audiologists. Obviously, education is very different as well, so the level of education and the amount of years of schooling is very different. But in Ontario, certain programs look for a regulated health professional for services, and the one that you mentioned does require that. So that's why they're sending you down that road of regulated health professional versus not.
So I was wondering if I could have a follow-up. So let's say I had my hearing tested by this person, and he said, I think you could benefit from hearing aid. Would I then go to my family doctor and get a prescription?
Yes, you would.
What's that profession called?
Hearing instrument specialist in Ontario. That name changes in other provinces in
Hearing
Canada.
instrument specialist was how he introduced himself, that's right. Good to know, I have a strategy now, thank you.
Okay. When we come back, final thoughts from our panelists. That's next. Welcome back. It's now time for final thoughts from our panelists. Let's go around the table, starting to my left.
So I really think that it's important for everyone to get their hearing tested as we sort of progress into your 40s and 50s, just to get a baseline. I think that's an important thing for your health prevention in general.
We already get our eyes checked every other year. We get our teeth checked all the time, so hearing tests should be part of that battery. It's so important to get in to get hearing aids. We have that trial period, so let's utilize that so we can get your hearing as close to normal as we can.
I learned that there is no cure, but there are aids, and I'm very, very grateful to hear that, and I hope Bill Shatner is listening to this program.
Yeah, just be like Nike and just do it. And the other thing is to be wary what I said about the unilateral symptoms with that, particularly if you have balance troubles or dizziness or vertigo along with that, that might be a warning sign of something more sinister.
And to add to that, I think that's why it's so important to be seen by a professional, so a hearing healthcare professional, so that we can identify red flags and make sure that they're seeing the right professional. I know there's a lot available online, but your first stop should be at a healthcare professional.
And that's it for us this evening. Hearing loss can sneak up on you, but once you or your loved one realizes it's happening, don't put off getting it checked out. You'll be happier if you are able to fully participate in conversations or social events with friends and family. And to get in touch, send us an email at comments@thezoomer.com. As always, thank you to my panel and to you at home. We'll see you soon. For now, it's time to zoom out.